Hi everyone. So good evening. How are you all? How are you doing, guys? Yes, tell me. How are you doing? How are you all doing, guys? All good? Good evening. Let's start. Let's not wait much. And let's start. People will be joining by the time. And so guys, today I'm going to teach something completely out of the PPTs. Okay. No PPTs at all, but 100% practical and 100% my experience. And today's class is, I think, the class of the entire course. I'm telling you. I mean, there will be definitely two more classes, but today's class is one of the the class which was much needed for all of us, all of you. And so the fortunately, I came early from my exam, and I thought, like, okay, let's meet you guys for 45 minutes, 1 hour, not much. I'll not take 2 hours or one and a half hour today. I'll just take 45 minutes to 60 minutes class. That's all. Okay. But in today's class, we'll be discussing 100% practical part. 100% practical part. So let me share. No questions for you today. No questions for you today. But you all have to give your full attention, and you have to ask a lot of questions in between, because today I'm going to talk about the importance of drug utilization review or drug utilization evaluation in the research. Okay, in the research, my favorite thing. So let me just share the screen. So I'll not be visible to you today because I'm taking the class from iPad, and here there is no camera options for me. I mean, I cannot show up, right? So DUE in research, DUE in research. Okay, so we are going to talk about research part today and how we can build the studies, what kind of studies we can put. Okay, we can put. So first, let me tell you guys that DUR is one of the essential tool in pharmaceutical research. Okay, this is one of the essential tool in pharmaceutical research. Okay, essential tool in pharmaceutical research. And where exactly do we use in it has the important roles in advancing the healthcare practices, improving the patient outcomes. I'll tell you how, and optimizing the medications and all. So let me just first tell you what are the major objectives and where we can use DUR. Or let me tell this also later. First, let me take you through all the types of studies what we can do with do with uh, DUE or DUR in pharmaceutical research. Okay, so focus, guys, focus. I need your 100% attention here. I need your 100% attention here, and then we will discuss this part. Okay, so let me just write here, like, DUE in research. Okay, research. Sorry, our DUE in research. So what we have to understand is, like, where we can use it. So I'll tell you the overall first, and then I'll tell you with examples one by one. So first thing, when we are talking about DUE or DUR, that is drug utilization evaluation and assessment. So first thing, what kind of studies you can make is, what kind of studies you can make is, focus here. You can make the notes also, or you can make the notes later. First you listen today, you can make the notes from recording. That's very important. First thing you can do is you can assess the medication safety. Assess the medication safety. And what is medication safety exactly, how it works and what it works is, so medication safety usually works with, like, the studies on supposed to be ADRs, right? ADR monitoring, or ADR reactions, or other drug adverse events, right? Drug events. And then there are maybe some contraindications, right? So keeping these things in mind, you can work on. And then safer prescribing practices also, right? Safer use of practice, safer practices, I'll say, safer practices of medication, right? Safer practices of medication. So first thing you have to keep in mind is assessing the medication safety. This is the first objective, or this is the first domain of DUE, where we can construct the studies and we can do the studies, we can tell our students, if we are faculty members here, I know many faculty members are there, so we can ask them to conduct the studies towards, or keeping medication safety assessment in mind. Okay, keeping medication safety assessment in mind. Number two, if I talk about, is it's very simple. When we are talking about assessment of safety, then we can definitely talk about optimization of therapeutic outcomes. Okay, therapeutic outcomes. Therapeutic outcomes. So what is the optimization of therapeutic outcomes? In that, what you do is, you do the studies usually related to, when we are talking about the therapeutic outcome, that means effectiveness. That means effectiveness. So effectiveness or efficacy related studies you can do. Okay, efficacy related studies you can do. You can do the real time data studies. Okay, real time comparison studies you can do. So you can do multiple type of things. And then you can also do one of the important, being the pharmd or mbbs or anything, you can work on some kind of studies in like dose adjustment. Okay, you must have seen that dose adjustment is one of the important domain. Why it is important domain is, dose adjustment is because, see, on the clinical conditions, on the basis of clinical conditions and multiple things, we assess the dose, and we then adjust adjust the doses, their frequency, or we determine the treatment duration, or we replace the things. So these all come under the dose adjustment, right? So when we are talking about optimization of therapeutic outcomes, we can do some studies related to efficacy, real time comparisons, and dose adjustment. Okay, dose adjustment. And if we talk about next part, that is third part, this is second, this was first. So if I talk about, then what else is, when we are doing everything real time, then definitely third thing will come. What? Evidence based practice. Evidence based practice. And what is evidence based practice? What type of studies we can construct about evidence based practices? We can definitely work on drug appropriateness. Drug appropriateness. Okay, drug appropriateness based on the clinical guidelines. So we can check the prescription pattern, and we can compare with the clinical guidelines. So that will help you help you conducting the studies. And those studies can be under the DUR, those studies can be helpful, right? And in that, you can also work on the drug utilization evaluation, drug utilization, actual drug utilization, according to according to medication guidelines, according to the clinical guidelines that we so that you can do here, right? That kind of studies you can do here. Then okay, and then there is something else, like if we are doing that, then we can also work on, like cost effectiveness analysis, right? Cost effectiveness analysis. Cost effectiveness analysis. Cost effectiveness analysis we can do. So how cost effectiveness analysis we can do? We can do some pharmacoeconomic studies, right? Pharmacoeconomic studies we can do. And we can also work on the economical burden. We can also work on the economic burden. See, we can conduct any type of study, either observational or intervention, in these domains. I'll tell you one by one. I will tell you one by one. Then we can also work on the rational use, right? Rational use. So safety is different. Rational use of treatment, rational use of drugs is different. Okay, rational use of drug means, like, you can work on polypharmacy, right? You can construct the study around the polypharmacy and off-label use of medications, off-label use of medicines. And you can work on the guidelines making. Based on that guidelines making, these all are 100% possible for the students and faculty members to conduct. Okay, these type of study, this is number 4 5. Okay, so not only 5, there are multiple more. Okay, if I go next, then you can do some studies, based on that you can make some studies on like supporting the regulatory decisions. I think this is zyada ho gaya. Yeah. supporting the regulatory decisions, so what type of studies supporting the regulatory decisions are there? What type of studies can be conducted? See, simple. PMS, post marketing surveillance. Okay, post marketing surveillance studies, or phase for clinical data assessment registries, that kind of studies can be done, where you can again work on the warnings, and you can work on the availability of the drug, you can work on the health related quality of life here in that, okay, based on that. And then you can also work on the problems related to AMR, antimicrobial resistance. Okay, antimicrobial resistance also you can work on, because this is one of the important topic again. Antimicrobial resistance also you can work on. So in that, you can do some kind of critical research on AMR. You can address the pattern of antibiotic prescribing, right? Pattern of antibiotic prescribing, antibiotic prescribing. You can work on the stewardship program, stewardship programs, or the research related to the stewardship program. You can work on the drug resistance, right? You can work on the drug resistance. So multiple type of studies you can do. Today I'm going to tell you everything, like how you can even plan the studies. I will tell you, at least 2 to 3 examples around each and every one. Okay, I mean each and every topic here I will tell you. Okay, so you can easily make some kind of questions, make some kind of things. Yes, precision medicines also I'm coming to. So then after AMR you can also work, because drug utilization review, DUR, is population based, so we can work on the population based trend also, population based trends also. Okay, we can work on the population based trends. And what are population based trends are? Like we can work on the different age groups, studies in different age groups. We can do in different comorbid conditions, right? Different comorbid conditions. And we can also work on the tailored interventions in these groups, we can work on the health disparities, right? Health differences between young and adults. So these type of studies are called as health disparities, right? And so these kind of things, disparities are there, health disparities are there, so you can do these type of studies. So guys, there are a lot of things to discuss in this. And then definitely the precision medicine, then definitely the precision medicine, personalized medicine. So personalized medicine related studies. Okay, personalized medicine related studies you can do, personalized medicine studies. Okay, so personalized medicine studies means, like you can use the DUE or DUR data for genetic and environmental or behavioral factors, which are important in influencing the drug response, which are important in influencing the drug response. Okay, influencing the drug response. And then you can also work on some patient specific patient specific characteristics. Okay, patient specific characteristics for medication management. Okay, medication management. So guys, there are a lot of things to discuss today and a lot of things to understand, lot of things. Okay, so let me start one by one. Let me start one by one with examples, so you can understand. Okay, so you can easily understand. Okay, okay guys, shall we start with one by one, so you can easily understand with examples? And please ask me the questions, please ask me the questions if there are. It was just an overview of the research, it was just an overview for the research. I mean, the research belongs to DUE or DUR. So let me just start one by one. So first thing was, what we were discussing is, first thing was medication safety. Okay, medication safety, medication safety. I'll give you the examples and I will give you the assumptions. I'll give you multiple things here. So in the when we talk about assessment of medication safety, so first thing what comes in our mind is like ADRs. like ADR. So let's construct one study on ADR. First study, cohort study. Okay, let's construct, because I want to check the cohort study. I want to check the ADRs in specific medications, or specific disease in suppose like I want to do cohort study in heart failure patient. Okay, heart failure patient, guys. Heart failure patients, right? This is the example, cohort study in heart failure patient. So what will be my objective? What will be my objective if I'm working on heart failure patient for ADR checking? This is the first example, ADRs. For ADRs, assessment of ADR, cohort study on ADRs, right? So what will be my objective? What I'll try, I'll see like what is the incidences first of all of ADRs in patient taking the heart failure medications over time, over like 1 month, 2 months, or 1 year. Like this we can do, and then we can not only stop here, we can identify those ADRs for the types, we can quantify those ADRs for the severity. Understand? So our aim of the study, we can keep the major aim, we can keep identity, identification, right? Identification and quantification. Quantification means the severity and all, identification means the types of ADR, and quantification and the incidence of ADR in any disease you can ask for, of ADR in heart failure patients. Heart failure patients taking heart failure drugs only, right? So what kind of what kind of study design you can apply here? Let's conduct the study here, let's plan the study here. So suppose I want to start the cohort study. See everyone, these are the examples you can directly take from here. Okay, you can just replace the disease and your studies will be ready. Okay, your studies will be ready. That's why I am teaching you with the examples. I have got some examples, some good examples, and I'm creating, or as per my experience, I'm creating these examples for you. Okay, so let's identify and quantify the ADRs with the incidences of ADRs in heart failure patients. So what kind of studies you will do? It is already there, na? It is already there. You can do the cohort study. But how you will conduct this cohort study? You will conduct like, you will enroll the two groups, right? You will enroll two groups means how? Two groups, one is like you all heart failure patients only. But if you want to check the safety of a particular drug, you can take like the patient, suppose ARB, right? Suppose ARB related ADRs you want to check. So you will get two groups, like one who are taking ARB, you know who are taking ARB, and who are not taking ARB, right? Not taking ARB, right? Not taking ARB. Suppose not taking ARB. This is observational study. This is cohort study. Observational study, not taking ARBs, right? Angiotensin receptor blockers. Okay, they are not taking ARBs. Okay, and then you will follow up them. You will monitor and follow up them for like any duration. You can keep for 30 days. You can keep for 60 days. You can keep for 90 days. You can keep for 1 year. Any number of months you can follow up. Okay, you can follow up these things, and based on that, at the end you can get the outcome. You can get the outcome, like your outcome of this study will be coming like, first of all, the incidence of ADR, like how many ADRs are there. Then there is you will quantify like severity of the ADRs, right? Severity of the ADRs. But before that, you have to the classify and identify, right? So you will classify and identify the ADRs, and then checking the incidence of ADR, like what type of ADRs in what quantity. And then you can go for the severity assessment of the ADR. Okay, so this is the simplest one. And if I give you the example exactly, you can just do one like the cohort study evaluating the risk of gastrointestinal bleeding in patient on high dose NSAIDs, okay, versus low dose NSAIDs. You can do like that also. Comparative studies also you can do some comparative studies also. Like another example here is a cohort study, right? Cohort study evaluating the risk, evaluating the risk of GI bleeding, right? GI bleeding in patients on high dose, high dose versus low dose NSAIDs. Okay, simple studies you can do. Okay, simple type of studies you can do. This is the first example on like the ADRs, but medical safety is not only about ADRs. Medical safety is more than that. So if I want to take another thing on this, if I want to take another example for this in the patient safety only, what I'll take is I will take cross-sectional study now. Okay, I will take the cross-sectional study now, and let me take what is cross-sectional study, guys. Usually, what is cross-sectional studies? Tell me. Do you know what is cross-sectional study? I will do one cross-sectional study here. Can anyone tell me what is cross-sectional study? I told you in the last classes. Last classes means not everyone, but my interns and many people from the epidemiology class. Tell me what is cross-sectional study, guys. For a particular period of time. Yes. For a particular period of time, maybe 1 month, 3 months, 6 months, or 12 months, not more than that, not more than 12 months. Okay, not more than 12 months. Okay, not more than 12 months. So let's construct a cross-sectional study. But how, what we should take now, what topic in the safety assessment we can take? Okay, let's take the simplest one. The objective of this study, let's take assessment of identifying and checking the prevalence of drug related problems. Drug related problems means what? Let's take drug interaction. You can take one, you can take many also. Drug interactions. Okay, drug interactions in a specific point of time, definitely within 6 months or 1 year, in a specific population. Again, specific population means you have to take the specific population, like in suppose you want to check the prevalence of the drug related problems in the hypertensive patients. Okay, in the hypertension patients who are taking more than two drugs, who are taking more than two drugs. So assessment of like the identification and the prevalence of drug related problems, drug interaction in the population with hypertension who are taking more than two drugs. So what you will do now, if it is a cross-sectional study, usually it will be the retrospective and not prospective. Sometimes it is prospective, but if you want to check the drug related problems, what you will do is you go back and check the data from healthcare data. Or if you want to do the prospective also, you can also do the prospective. This type of study you can do the prospective also. So what you will do is what you will do in the process, you will collect the data history, you will collect the medication history, right? And you will collect the clinical data, uh, clinical data from the patient when he's coming on the routine visits, right? Routine visits, you will ask for if the patient had any kind of any kind of problems he faced, or any kind of interaction related problems he faced, any kind of sign and symptoms he faced, or any kind of discomfort, allergy he faced while taking these two drugs or these three drugs together, how he's taking, right? So you can analyze that part. You can analyze drug related problems, you can identify them, you can check the prevalence, and along with that you can also check if the combination or dosing in the combination. Okay, if the combination of the drugs or dosing in the combination. Okay, sometimes dosing we have to, when we are giving two drugs together, we have to work on the dosing part. If the dosing of the drug is appropriate or not, so this is nothing about but about your drug related problems, how you can construct the studies. Okay, how you can construct the studies? You can construct the cross sectional study also, and you can also construct, let me tell you, you can also construct, let me tell you the third type. You can also construct the case control studies. Okay, you can also construct the case control studies in what? Case control studies in what we can do when we are talking about the drug safety and assessment. When we are talking about drug safety and assessment, we definitely have to talk about ADRs and all these only, ADRs, drug related problems and all. So you can also do the drug related studies, I mean case control studies on rare ADRs, rare ADRs, because cross control, I mean, case control studies are usually used for the rare things when we have the exposure with us, but we want, I mean, we have the outcome with us, but we want to check the exposure, right? We want to check the exposure. So in that, we go for it. We go for the, suppose rare ADRs, suppose rare ADRs, right? Like suppose, let me take an example here. Okay, let me take an example for you guys so you can understand easily. So suppose a case control study, let me get some rare cases, rare ADRs. um, a case control study on, okay, have you heard of this guys, fluoro, okay, fluoroquinolone, fluoroquinolone use and tendon rupture? Have you heard of this before? Have you heard of this? Fluoroquinolones usually do the tendon ruptures. Okay, usually do the tendon ruptures. Okay, when they are taken as an antibiotic, they do the tendon rupture in our body, usually in our brain and our, the vital organs. Tendon rupture. Okay, they do the tendon rupture. Do you know that? Do you know that fluoroquinolone induced tendon ruptures? Have you heard of this before, guys? Fluoroquinolone induced tendon ruptures. Have you heard of this before? No. Okay. Yeah. So there is, yes, Aftab, there is the fluoroquinolone related tendon rupture. There is one of the rare ADR. That is one of the rare ADR. So in that you can construct the study. And how you can construct? How you can construct? You can keep like you can get one group. You can get patients, one group of patients who took fluoroquinolones. Okay, who took fluoroquinolones, and then what you will do is, in that who received the ADR, I mean who developed the ADR, developed and non-developed, not developed. Okay, not developed, right? ADR developed or not developed. So the patient who developed the ADR will be our case, and not developed will be control. And now we will go back for the suspected factor. Then we'll go back to the exposure to assess the exposure as a suspected variable or suspected drug. If you want to check for the drug suspected, and then once we collect the data related to that, we will analyze and we will find out if the correlation is there with the drug or something else, with the correlation is there with the drug or something else. So that is called case control studies. That's how you can start, start thinking of the studies, right? So guys, first domain, as I was telling you, assessing the medication safety. So medication safety assessment, I told you how to construct the cohort study, how we can construct the cross sectional studies, how we can construct the case control studies, right? Three types of studies you can usually construct. I mean many more, but I'm just giving an example. Like three types of studies are very easy to conduct, and you can just check with you like what type of studies you want to do, what type of studies you don't want to do, what you want to do or what you don't want to do. You can plan it for your student, for yourself, and you can you can use these type of studies for further use in your studies, right? So this is about one assessment of that. So guys, tell me one thing before I go further. Is it okay? Is it okay how I'm teaching? Are you understanding this or not? Are you getting it or not? Yes, guys. Are you getting it? Are you getting it? Is it good? Is it good? Like the topic and all? Okay. Okay with that? Okay. Great. Okay. So is it Yeah, so this is definitely important, and you can use these things in your life, in your studies. As a researcher, you can take this class you can take with you, you can keep with you, you can make notes. And if possible, I'll also try to make this PDF. I'll also get this PDF where I'm writing whatever is my writing skills. You have to bear with that, but I'll try to get the PDF and share with you, okay, at the end. Right, so now let's come to the second domain. Okay, let's come to the second domain. And what was that second domain? Second domain was nothing but we were talking about optimizing the therapeutic outcomes, right? Optimizing the therapeutic outcomes. Okay, therapeutic outcomes. Okay. Sorry guys. Therapeutic outcomes. So what exactly we talked about? We talked about dosing strategies, we talked about medication adherence here, right? We talked about treatment options here, right? So this is a little tricky, guys, to understand. Okay, let's understand, and let's go a little more deeper into the study types, little more deeper into the study types. So here I'm going to talk about the dosing strategies first. Okay, dosing strategies with example. Dosing strategies with examples. How? Like suppose I want to do the effectiveness of two dosing of a medicament for a medication in achieving the target therapeutic outcome. Suppose like standard dose versus low dose aspirin in preventing cardiovascular event in high risk patient. Okay, I'll take this example. I'll take this example like I will take this example, comparing standard dose standard dose and low dose of aspirin in preventing CVD in high risk patients. High risk patients means what? See, when you are comparing the standard dose and low dose aspirin in preventing the cardiovascular disease, means the patients are not cardiovascular. Okay, these patients are having the high risk like maybe hypertension, maybe smoking, right? Maybe diabetes mellitus, or maybe high level of work stress, right? So these people are on you know uh, high risk factors. These people are on the high risk to get CVDs. So this is recommended that you can start with the standard dose, the low dose or standard dose of aspirin. So we can plan the therapeutic outcome. In that only we can plan the therapeutic outcome, like comparing standard dose versus low dose in preventing the cardiovascular event in high risk patients. High risk patients. So what type of study do you want to plan, guys? Tell me what type of study will plan here. What type of study would you plan here? Now I got you the topic. Tell me what type of study you will plan with this topic. Yes, people. Tell me fast. If I want to compare the standard dose versus low dose of aspirin in preventing the cardiovascular disease, then how would you compare? What would you compare? Yes, people. Come on. Tell me what type of study you can do, guys. Fast. Comparative studies. Wonderful. What is comparative studies? Anyone else? Guys, come on, put the words here. Fast, fast. Yes, guys. Yes, guys. Cross-sectional, cohort, perspective, perspective. What is perspective, guys? Come on. Yes. Okay, so let me tell you. I initially started with something called, let's think of a little in depth. So I will not go for cohort or cross sectional or prospective studies. I mean, the cross sectional studies or something like that. What I'll do is I will plan an RCT here. I will plan an RCT here. Okay, what is that RCT? RCT is nothing but randomized controlled trials. Randomized control trial. Okay, control trials, randomized control trials. And how I will prepare this, how I will do that. See, I will check, compare, I will do that. What will be my comparison? What will be my comparison here? My comparison will be compare the effectiveness, right? The effectiveness of two dosings, right? Of two dosings, right? Two dosings in achieving the therapeutic target, in achieving the therapeutic therapeutic target. So what will be my outcome to achieve? What will be my hypothesis here? What will be my hypothesis here? My hypothesis will be like, I want to see the symptoms control. Okay, symptoms control, right? Symptoms control, like the patient should not get the symptoms. Like suppose I'm taking this for next 1 year. Okay, in 1 year or 5 year, long term studies, these are 1 year or 5 years. Like you can plan for 3 year, 1 year, 2 year, 5 years to check the effectiveness of any therapy. Okay, not only the precautionary therapy or prophylactic therapies, but for the like normal given therapies also you can check this. Okay, for the normal given therapies also you can check this. So first is symptoms control. Okay, you can check for the symptoms control. You can check the biomarkers. Biomarkers, like if the biomarkers are increasing or decreasing over the time. Or you can check for the you know not only the symptoms, but there are some signs also, sign and symptoms. You can check for sign and symptoms. You can check for adverse event, adverse effect of what? Adverse effect of the like the risk factors, adverse effect of the drug risk factors. And these are towards the condition, towards the cardiovascular disease, right? Here you can look after the patients, look after the groups for upcoming 1 year or 5 year, whatever duration you take. And how you can plan the randomized control trial? Then what you will do is, here you will randomizing the patient, you will randomly take the patients in a standard dose or low dose regimen. See, correct, you can do the cohort study also, you can do the cross sectional also, you can do the cross sectional in the past data or present data. Okay, but that will be not sufficient. Why I'm telling you? Listen guys, of what I'm telling, listen to it carefully. When you are talking about cross sectional studies, see, when we want to check for the efficacy of the studies, like when we are talking about efficacy under the therapeutic outcome, then we just don't do the cross sectional studies, because cross sectional studies are very short term. In short term you will not get the enough result to justify your study. You will not get enough results to justify your study. And why not cohort? Why not cohort? Because see, cohort can be done here. But in cohort, what is there? That there will be selection bias. Okay, I'll write here selection bias. Selection bias is the important part. In cohort, what you will think is, you will give the high dose of aspirin. You will give the high dose of aspirin where risk is more. You will give the low dose of aspirin where risk is less. Understand? You're understanding what I'm saying? Like, if there are the people on high risk or low risk, you will be deciding according to that. You will be assigning according to that. You will be giving the drug according to that, right? So that will be a perfect case of selection bias that we don't want. So what we do is, we do it for randomized controlled trial. Okay, we go for randomized controlled trial. If you want to check the efficacy of the drug, then always go for randomized controlled trial, because randomized controlled trials are the time bound studies. First of all, not time bound studies, controlled environment studies. Randomized controlled trials are controlled environment studies. control environment studies. Okay. Control environment studies. What is control environment studies? Here, the inclusion criteria, exclusion criteria, everything is everything is controlled. Here, bias is controlled. Here, arms are controlled. You know, arms means what are the arms? Arms means like, you know, one is randomized. I mean, both are randomized arm, but like one is case, one is control, like low dose and high dose, right? One is high dose versus one is low dose in this case, right? So there, everything will be controlled environment, controlled environment. So what you will do is now whatever the patient are taking, whatever the patient coming with high risk, guys, focus, high risk. If the patients are coming with high risk, what you will do is you will assign them randomly into low dose and high dose to the sufficient number, like to the you know, number whatever you want to achieve, like the sample size, up to the sample size you will take low dose and high dose. You will randomizing, you will randomly send the patient to low dose or high dose. There is, you are not doing the selection bias, whether the patient has very high risk or whether the patient has only high risk, right? So they all will be taking low dose or high dose, but that those will be randomly assigned. Okay, now after this you can follow them up for 2 years or 1 year or 3 years, whatever is your duration. I mean, based on the drug and things, you can follow up for them, you know, follow up them for efficacy and safety check. Efficacy and safety check. Efficacy and safety check, as I told you, efficacy will be checked by what? By the symptom control, by the biomarker levels, and you know, and then safety you can check by the adverse event of the drug, if they are appearing with any, you know, adverse drug reaction or adverse drug, you know, effect. So you can work on optimizing therapeutic outcomes. You can plan for direct efficacy related studies, and you can go for randomized control trial, randomized control trial. So guys, one more thing here, two very important for you to understand is, if you are assigning them into the random groups, or you are assigning them into the groups randomly, then you are putting the intervention, means you are giving the drug, you are giving the drug, you are giving the low dose and high dose drug. Okay, you are giving the drug, you are giving the drug means you are the principal investigator, and if the doctor is giving prescribing, that is there, but you are assigning the drug to the so sorry, I'm having the little cold, guys, I'm so sorry. Okay, and now the second thing is you can do cohort when you are just observing. Here you are intervening. Here in randomized control trial you are intervening, and if you want to just do the observational study, you can do the cohort study. But again, cohort studies are weaker studies. Cohort studies are, guys, cohort studies are weaker studies here, weaker than randomized control trial for efficacy. Okay, if you want to check efficacy, you don't need to go for cohort, you have to go for randomized control trial. Okay, randomized control trial. Understood, guys? Anything else? Sir, is RCT possible with comparing efficacy of two different drugs? Absolutely, Anupama. Absolutely, you can do that. Okay, absolutely, you can do that. Yes, absolutely, you can do that. Any questions, guys, till now? Okay, no questions here. Okay, am I audible? Cool. So now let me take one more example in this. Let me take one more example in this. So as you are talking about, you know, you are talking about comparison. Let me take another comparison study only here. Okay. Let me take one comparison study only in outcome research. Okay. In outcome, we are talking about therapeutic outcome research, right? Therapeutic outcome research. So let me take one comparative study that is called as comparative effective study. Okay, comparative effectiveness research. Okay, research, CER, on treatment options, on treatment options. How to do the CER studies? How to do the CER studies? Suppose as you are asking, just ask someone, just ask, can we do it on two drugs? Okay, CR studies can be done. This is the DUE, example of DUE. See, you are comparing, guys, focus here. You are comparing, suppose let's take the diabetes example, comparing the effectiveness of SGLT2 inhibitors versus GLP-1 inhibitor, GLP-1 receptor antagonist. Okay, GLP-1 receptor antagonist. Do you know what are these drugs? Can you give me the example of one SGLT2 and one GLP-1, guys, in diabetes patients? Okay, so let's take, this is the example, diabetes patients, okay, and diabetes population, type 2 diabetes population. So this is the CER study, like the comparative effectiveness research, comparing the effectiveness of SGLT2 inhibitors versus GLP-1 receptor antagonist. Can someone tell me one example of both, guys, fast? Empagliflozin is what? SGLT or GLP-1? Okay, SGLT2 inhibitors. Okay, so SGLT2 inhibitors are all gliflozins. Okay, SGLT2 inhibitor is not semaglutide. Semaglutide is GLP-1. Ramya, SGLT2 is dapagliflozin, empagliflozin, canagliflozin. Okay, empagliflozin, canagliflozin, dapagliflozin are SGLT2 inhibitors, and semaglutide and other glutides are what? Are GLP-1 receptor antagonist. GLP-1 receptor antagonist. Now, what you will do when we are talking about CER study? So, what you will do is you will compare the therapeutic outcomes of these two or more treatment options in the same condition. In the same condition, you can give two or more treatment also. You can take two or more also. Okay, you can take two or more things also. So, what you will do is you can take any type of approach, either experimental approach. You can take the experimental approach also. Okay, let me describe experimental approach also. You can take the observational approach also. Okay, observational approach also. I'm telling you, it will be overwhelmed for you guys. It will be overwhelmed for you. So you must go through this class more than 5 times. Then only you will understand each and every aspect, and then read what is experimental approach, what is observational approach. So now you are getting the idea per idea. You're getting a lot of ideas of research right today. So here, when we are talking about experimental or observational, you can do anything. If it is experimental, then you are the person who is assigning the treatment. If you are the observational person, if you are observer, then someone else has assigned. So in this case, when you are doing the CER, guys, focus here what I'm telling again. If I'm telling that we are doing comparative effectiveness research, then here you can go for the observational research also, cohort research also. But if it is like, if I'm telling that comparing two therapies in like one drug, comparing the one drug, different dosing form, then you need a specific environment, that is controlled environment. But here, when you're talking about two drugs, that also can be done with the randomized control trial, that is experimental approach, or the observational approach also you can take. Okay, you can compare the drugs, you can compare the biologics, you can compare the treatment modalities, you can compare yoga versus drugs, you can compare meditation versus drugs. Any type of studies you can plan in this comparative effectiveness approach. Okay, in comparative effectiveness in comparative effectiveness research, you can compare any type of therapies, right? So in these two approaches, like, what you will look for, you will again look for symptoms relief at the end, symptoms relief by both, symptoms relief, and then you will compare. Then time to recovery, you can check. Outcome will be time to recovery, right? You can check for time to recovery. You can also check for long-term survival, right? Long-term survival. And you can also check for hospital visits or rehospitalizations, hospital visits or rehospitalizations. You can check for these things, right? So that kind of studies you can plan, as I told you, cost, the comparative effectiveness studies. Comparative effectiveness studies you can check out of that. There are multiple type of studies I can tell you within this domain. I can tell you multiple type of studies within this domain, but we have to discuss everything. We have to discuss everything. So you can plan now. Okay, the third domain what I was talking about was, after these things, let's go for something evidence based medicine. Evidence, you know uh, based practice. Evidence based practice. Evidence based practice. What is evidence based practice? So tell me, if I'm planning like the efficacy of direct oral anticoagulants versus warfarin in preventing stroke in not artificial, atrial fibrillation patients, in atrial fibrillation patients. Okay, after exam I think I'm tired, exhausted, but that's okay. See, like efficacy on the direct anticoagulants, coagulants versus warfarin in preventing stroke, in AF patients. AF patients. Suppose I am taking this study. So tell me what you can do with this topic. This is the topic. What you can do, guys, with this topic? What you can do? Tell me fast. Definitely, we are not going to come. We are not going to complete this class today. But yes, at least something. Yes, guys. What type of study or what type of things you can imagine with this topic? Yes. Yes, guys. What kind of work you can do on this? Efficacy of the direct anticoagulants versus warfarin in preventing stroke in atrial fibrillation patients. What kind of study you can plan here? What kind of things you can plan here? Yes, guys, fast. Come on. Cohort. Okay. Mohit is not there in the today's class. Mohit is there. Why I'm not getting answers from you, Mohit? Yes. Yes, guys. What type of studies we can plan? First, read the question once again. Read the topic once again. Efficacy of the direct anticoagulants versus warfarin versus warfarin in preventing the stroke, cross sectional studies. Okay, cross sectional studies. So if I am there, guys, if I am there, I'll go, little more, what we say, little more leisure with me. I will not give myself that much, stress of conducting a study. Understanding what I'm saying here? If I am there at your place, I will not put myself in this much trouble. Okay. I'll not put myself in this much trouble. And what I'll do is, I will rather go with systematic review and meta-analysis. I'll not go for the study. I'll go for systematic review and meta-analysis. Is it correct or wrong? Shall I go for it or not? Yeah, systematic review and meta-analysis. Yes. Why I can't go for study? Why I should not go for study? My question, I will correct my question. I'll not ask you why can't I go for the study. I will ask you why I should not go for this topic for the proper study. Why I should just compromise, my feelings with only systematic review and meta-analysis. Tell me. Yes, guys, fast. Come on. Yes. Why? In this class, you are learning all about the types of studies. You are learning about the examples. You are seeing the real time, studies and new topics in front of you. Yes, because it's evidence based. Absolutely. First thing, because it is evidence based. Okay, it is evidence based. And the second thing, when I'm talking about efficacy of the direct anticoagulants versus warfarin in preventing stroke is not the future term. This is not the future term. That means the studies have already been done. That means the studies have been already done. Remember this, guys. The studies already have been done in AF patients. Okay, for different anticoagulants, maybe not together, maybe for different anticoagulants and different, for the warfarin different doses in AF patients. So what we have to do is we just have to collect the data and do one study. Okay, do one meta-analysis or systematic review. We have to collect all the evidences. First of all, it is not possible to conduct a study, whether it is observational or the randomized control trial or efficacy study with all the anticoagulants versus warfarin. Okay, because there are multiple things and there are not many stroke patient in one hospital, and this comparison will be so expensive in the terms of study, because you have to conduct this study in multiple centers, multiple countries maybe, to get the sufficient number of patient with all the drugs. Okay, so when I'm talking about efficacy of the direct anticoagulants, it includes all the anticoagulants, rivaroxaban, or maybe it is rivaroxaban or other apexaban, and any other things. Okay, and then acetrom, it could be acetrom also, esinocamerel, it could be warfarin. I mean, along with then we are comparing this with warfarin. So there are different conditions for acetrom. There are different conditions for apexaban or rivaroxaban, and then in those conditions we have to check these things, and then we have to come to the conclusion. We have to make the hypothesis. So that study is hypothetically not possible. I mean, hypothetically possible, but originally that is not possible, because it takes a lot of resources, lot of patients we need. First of all, you will not get all type of patients at one center. Okay, so that's why when I'm talking about all the drugs, you have to think of preventing in specific population like stroke in AF patients only. Then you need evidenced data already which is published, and based on that you can do the systematic review or meta analysis. You can do the systematic review or meta analysis, so you can directly check the efficacy of docs, these oral anticoagulants versus warfarin. Okay, it absolutely robust, it offers the robust evidences, like the wider evidences to update the clinical guidelines, and it supports the decision making in anticoagulation therapy. What you will check here, you will identify, appraise, and summarize the results from existing controlled trials or observational studies. So you will take all RCTs, you will take all observational studies, you will combine, and then you will make the SR and MA, systematic review and meta analysis of this. Okay, you can make that. You can make that now. You can also make one study. I'll tell you, you must have not heard of these studies. I'll give you the example, and you have to tell me what kind of study we can do. We are talking about evidence-based practices. Okay, our major topic here is evidence-based practices. Now I'll give you one more example. Okay, now I will give you one more example, and you have to tell me. Okay, so you have to tell me one thing, like I want to evaluate the adoption of, suppose, heart failure management guidelines in community settings. Okay, heart failure management guidelines, such as, like, suppose GDMT. I want to observe if every doctor in community centers, they are following the guideline directed medical therapy. This is guideline directed medical therapy. Guideline directed medical therapy means you are giving the drugs according to the guidelines. Okay, according to the guidelines. So that is called as GDMT. Okay, we call it GDMT, guidelines directed medication therapy. So if I want to check the adoption, if I want to evaluate if this is adopted or not, heart failure management guidelines are adopted into the community settings or not. So what kind of study I have to do, guys? Tell me. Yes. Yes, guys. What kind of studies I can do here? Tell me fast. After this will not take. Only will take this only. Okay. Then rest will take day after tomorrow or tomorrow. Systematic review. Ooh. Okay. Anyone else? Okay. Let me stop your thinking here. There is no systematic review or evidence. I mean, there is no systematic review or meta-analysis. Prospective efficacy studies, okay, case control study, cross-sectional studies. Guys, listen to the question first. I want to evaluate if the heart failure management guidelines are adapted in the community settings. If the doctors are evaluating, I mean, doctors are using these heart failure guidelines for the heart failure management. I just want to check this. So what kind of study? Prospective efficacy studies, okay, case control study, cross-sectional studies. No, why you are keeping question mark? Why you are asking me? I'm asking you, guys. I'm asking you. You cannot ask me. Retrospective. Retrospective, okay. Retrospective or prospective, we can do both. Okay, I'll take this. Retrospective or prospective both. Okay. Retrospective or prospective both. Prospective, both we can do. How and what do we do? RCTs, okay. So guys, listen, you must have not even heard of this. You must have not even heard of this. How many of you have heard of PBRN studies? PBRN studies. How many have heard of PBRN studies, guys? Have you heard of PBRN studies? PBRN studies. Anyone? No? Okay, great. Great. That was my expectation. See, so PBRN studies are nothing but, let me first explain this. What is PBRN? PBRN is P for practice based research network. Research network. Practice based research network study. We call it practice based research research network study. And why we call it, how we call it? Because first of all, this will be not only one center. First of all, this will be multi-center study. When we are talking multi-center means we are talking about multiple doctors. Multiple practitioners. Multiple practitioners. Okay. Multiple practitioners and their practice habits. Their practice habits. We are going to talk about practice habits of multiple people. Right. And definitely, what type of study we will do here? What type of study we have to do here? We have to do observational only. We cannot do randomized control. We have to do observational study. We have to do observational study. How would you do that? That why we call it PRPN. PBRN. Like why we call it PBRN and why it is observational is how to do it. So what you will do it, you will do that first in the network hospitals. Network hospital means all the primary care hospitals or tertiary care hospitals associated with one government, one name, like one hospital or maybe one institution. So we can check it like that. Okay, we can check it like that, or like suppose all the mohalla clinics in the Delhi, those I don't know those just exist or not. I'm just giving an example. Okay, those exist or not, that's not a concern here, but just giving an example like mohalla clinics in Delhi. Okay, we want to check if all the mohalla clinics are using heart failure management treatments similarly or not. All the doctors are facing, all the doctors are practicing the guideline directed medical therapy or not. Okay, so what we will do is we will make a practical, we will make a practice protocol. We will make a practice protocol, and then we will make a protocol to assess that practice protocol. Okay, and then we will check if every doctor is adhering that or not. If every doctor is adhering to that or not, adherence of the medical practices, adherence of the guidelines, if they are adhering to guidelines or not in their practice. Okay, how we will do that? We will definitely check each and every prescription of each and every doctor. We will assess how many diuretics have been used, how many ACE inhibitors have been used, what is the first line therapy he is giving, what is the second line therapy he is giving, what is the conditional therapy, what is the emergency therapy he is giving. All type of things we will do. Okay, so what we will check here, we will check for all the practices, all type of practices in all conditions for that particular condition or particular disease, right? So gaps in practice, first of all we will find out gaps in practice. Okay, this is a large studies, but definitely that can be planned easily. Okay, then we will find out the barriers. What are the barriers for different doctors or practitioners, why they are not following? Okay, and why, if they are like if they are aware of the guidelines or not. So here we can conduct a KAP study also along with that. In that only we can put the KAP, like this is kind of KAP survey, KAP observational study. Definitely this is like knowledge, aptitude and practice. Okay, how much they have knowledge about these guidelines, how much they have attitude to practice that, and how much they are actually practicing. Attitude to practice means based on their population, based on their patient, based on their patient's financial condition, based on the affordability, multiple things are there, right? Multiple things can be there. So based on these things, if they are actually practicing that or not, and what are the barriers? Okay, what are the barriers? So these people, what these people do is, these people work on everything. These people try to understand everything. These people try to understand everything. These people try to understand everything through that type of studies, through this type of studies only. Through what type of studies? PBRN studies, practice based research network. So practice based research network we call it, because we have to make a network of similar practice places and similar doctors who are working for heart failure under one network. One network means either one city, under one municipality, under one the name, like there are multiple Yasoda hospitals, multiple branches. There are Manipal hospitals, multiple branches, right? So like that, there are Medanta hospitals, multiple branches. So that kind of studies can be done to evaluate the adoption of the guidelines, or how they are using the guidelines, right guys? So these are the types of studies you can plan for. You can plan for any disease, any type of studies, right? So I think till now we have covered only three topics, but that's okay. I think that's fair enough. We don't have to worry about, like, if we are covering everything today, we can cover tomorrow also. So that's not a problem, guys. With that, I'll end the class because it's dinner time also and it's late. So you guys please fill the form and please ask me the questions. If you have any questions, guys, please ask me the questions. Now this is the question time. See, if I'm not asking you the questions, it does not mean that you also don't ask me the questions, guys. Okay, that doesn't mean that you also don't ask me the questions. So please ask me the questions. Yes, guys, questions please. Any questions? Did you understand or not? Tell me first. See guys, write the proper feedback if you are not liking the class, if you are not understanding the class, or if you want something else, if you're not exactly getting the class. I am trying my best. I'm trying the complete practical things. Okay, I'm trying complete practical things with my experiences, so you can understand easily. Okay, And still, if you're not understanding anything, please let me know. Yes, guys. So, and you can write your feedbacks also. I mean, if you cannot tell me directly in the class, you can write in the feedback. Feedback is being assessed by the team. Or you can tell me here how to teach, what to teach, and if you are missing something, if you're not getting, you can stop me in between. You can ask me questions. Definitely, these are new things for all of you. These are the new type of things what I'm bringing to make you update in this field and make you aware and make you understand. Like, okay, there is a lot of things which can be done easily. Okay. Okay, if you are understanding, then better. Guys, fill the form and then leave the class. No problem. Okay. Please fill the form. Take care, guys. Chalo, bye bye. Good night.